an investigation into naturopathic management of ADHD in children and adolescents, a cross-sectional study by TMackenzie. Hello, my area of research is attention deficit and/or hyperactivity disorder, otherwise known as ADHD, in children and adolescents, and the approaches that naturopaths take within whole systems research. According to the DSM-5, ADHD is a neurodevelopmental disorder characterized by inattention, disorganization, and hyperactivity impulsivity, which often persists into adulthood and can impair daily functioning. ADHD prevalence is actually on the rise and is said to affect more than 7% of children and 5% of adolescents in Australia. Diagnosis in Australia may involve a psychiatrist, psychologist, or a general practitioner. ADHD can cause health issues and decrease life expectancy. It can also increase the risk of accidents and injuries across the lifespan, and this really underscores the need for early intervention. Although 87% of ADHD cases are said to be mild to moderate, the current clinical guidelines state only medicate in severe cases, but overprescription is said to be common. In fact, research shows that more than 2/3 of children receive medication for ADHD, so there are valid concerns about overdiagnosis and overtreatment. Overmedication harms children and families, while doctors remain concerned about it but are confused about who to refer to and what can be used instead. ADHD-related costs are estimated at $20 billion. Given its complex etiology, a personalized, integrative approach is necessary for effective treatment of ADHD in this age group. The knowledge gap. Many people with ADHD turn to complementary and alternative medicine due to the effects of medication. Significant side effects of conventional treatments for ADHD include anorexia, weight loss, abdominal pain, sleep disturbances, headaches, irritability, anxiety, depression, and appetite suppression, and rare cases of stimulant-induced psychosis and sudden death. The Australasian ADHD Professionals Association, otherwise known as ADPA, their guidelines prioritise pharmacological treatment yet emphasise the need for research into non-drug alternatives. GPs have knowledge gaps about ADHD and are concerned about overmedication, but prefer multidisciplinary care. Nutritional deficiencies are also highly prevalent in children with ADHD, and supplementation has been found to be effective. A large systematic review found 16 high-quality trials on complementary medicines' effectiveness in ADHD, including nutrients like zinc, iron, omega-3 polyunsaturated fatty acids, herbal medicine, and dietary interventions, for example, the Mediterranean diet. There are also fewer adverse effects in CAM treatments, which underscores its safety and the need to evaluate its effectiveness. Whole systems research is an excellent way to explore naturopathic medicine as it aligns with naturopathic philosophy by emphasizing individualized care and explores multivariable health interventions. Whole systems research is very effective at exploring complex conditions, and it has started to be used to explore conditions such as endometriosis and diminished ovarian reserve within naturopathic care. Naturopathic interventions themselves are associated with improved outcomes and quality of life in chronic conditions, which warrants their evaluation for ADHD through the whole systems lens. Susan Arentz in 2024 argued that naturopaths and herbalists support patient-centered care by addressing individual context and leveraging strengths rather than pathologizing neurodivergence. However, empirical data on how this translates into clinical practice remains limited. Despite evidence supporting the effectiveness of naturopathic care, referrals for behavioural or lifestyle support remain low, and hesitancy towards naturopathy persists. Naturopathy could be a long-term cost-effective lifestyle-focused adjunct to ADHD management. Despite widespread use of CAM in Australia, the evidence for naturopathic management of ADHD is limited. There is a notable gap in the literature about the role naturopaths play overall, and especially in people with ADHD. My research question: what are the clinical approaches used by naturopaths in the management of ADHD in children and adolescents? My research aims and objectives are to identify the clinical approaches used by naturopaths in the management of ADHD in children and adolescents. By exploring accommodations such as child-friendly spaces and sensory environments. Do naturopaths provide these? Understanding how naturopathic appointments are structured. How long are they, and what kind of follow-up is offered? Are they modified for this cohort? Investigating treatment approaches. What modalities are used, and what kind of interventions are offered, and how are decisions around treatment made, and how are they shared? Looking at integration across modalities. What referrals and collaborations are considered? And understanding the different testing practices that naturopaths use, both functional and biomedical. Research methodology. The study design and data collection involves an online cross-sectional questionnaire created in REDCap and then distributed across various channels to participants. Channels include educational establishments, naturopathic associations, industry, and via social media. Once responses are submitted, data is stored in REDCap. REDCap stands for Research Electronic Data Capture, which is a secure web application designed to support data capture for research studies. Once collected, data is exported into Microsoft Excel, where it is cleaned and coded. It will be stored securely in the primary supervisor, Dr. Jessica Bay's OneDrive on a password-protected SCU laptop. The clean data will then be imported into SPSS, where the statistical analysis will be conducted. Results. So who has filled in the survey so far? The first results we have are the demographics, and as you can see, we have had 23 people complete the survey. We are only a few weeks into the project as ethics approval was delayed, so we do expect more participants to take part. So far, the average age of participants is 49. They are mainly female, or 82%, and commonly in New South Wales. No one in Tasmania, South Australia, or Northern Territory has filled in the survey yet. Most participants have been in practice for 1 to 5 years. And that was a surprise to me, as I thought we would have participants who had longer in clinical practice. But the next demographic was 6 to 10 years, followed by over 26 years. 78% of participants had a bachelor degree or higher qualification in naturopathy. Results. Presenting complaints. I thought I would pick out some things of interest. Based on the low numbers we have presently, it seemed interesting to look at one of our research aims, which was treatment approaches, and in particular presenting complaints. These are the priorities that patients present with and the main thing that they generally want help for. So you can see In the main, the most commonly reported symptom, which was found in 96% of cases, was difficulty concentrating. This was followed by insomnia and anxiety at 86%, hyperactivity at 82%, uncontrolled behavior and anger at 78%, uncontrolled emotions at 73%. You could say dysregulation is a better term to understand uncontrolled emotions. Restlessness followed at 69%, and then medication side effects at 52%. While still considerable, it was less than I was expecting based on the research showing that is a very common reason why people present to naturopaths. This is also relevant when you consider that in another finding, 76% of children and adolescents presenting to this group of naturopaths were already taking meds for ADHD, and all of them were also concurrently taking supplements and vitamins. Results. Interventions used by naturopaths. I thought it would be interesting to look at what kinds of interventions are naturopaths using in this group. And the most common intervention was vitamins at 89%, which is very interesting when you look at the research around micronutrients and how much they can really help this cohort. The next one was minerals at 78%, tied with omega-3 oils, then probiotics at 73%, and then we've got prebiotics, amino acids and liquid herbs at 68%, herbal tablets 63%, and herbal glycetrax at 52%. Some other interesting findings were that 76% were already taking medication for ADHD, and all of them were also concurrently taking supplements and vitamins. So all the children and adolescents with ADHD presenting to these naturopaths who answered the survey were already taking supplements and vitamins. So that makes us think about what's going on and why they have presented to a naturopath for further support. The other thing that was found was that every single naturopath checked contraindications against medications. So that's something that's happening within the consultation that may not be happening outside the consultation. We don't know, but we know that every naturopath is checking contraindications for the ADHD medication with any nutrients, herbs, or vitamins that they're recommending. The other interesting finding was the most frequent referrals were found to be for occupational therapists, psychologists, speech therapists, counsellors, and kinesiologists. So naturopaths are referring for multidisciplinary care, and I think this is something we can definitely look more into detail the more participants we have doing this survey. Referrals to GPs happened 72% of the time, which was interesting because as part of duty of care, we need to make sure we're referring our patients for proper follow-up. And many of these referrals were for pathology testing, and the most common testing was for full blood counts, liver function tests, thyroid studies, glucose, HbA1c, so that blood sugar regulation, iron studies, B12, zinc, and vitamin D. So when you look at the research, these are areas that have been found to be low in children with ADHD, especially the iron and the vitamin D, which has quite a lot of evidence to show that these vitamins and minerals are often low in children with ADHD. So we can see that naturopaths have been looking at this evidence perhaps and then referring to GPs to check to see, do these patients have deficiencies in these areas? With regards to functional testing, what was found was that functional testing often included gut microbiome, because some of the research does show that the gut microbiome can be affected by medication and perhaps even be a cause of some behavioral and or concentration issues. And the other one was hair mineral testing. And then you can see that the most common observations found by naturopaths after testing were mineral and vitamin deficiencies, including anemia, but also heavy metals, gut dysbiosis, so that's when there's an imbalance of bad to good bacteria, and also methylation issues, which would go in more detail into the B vitamin status, and that would make sense with regards to neurotransmitter production and function. So those were all of my results that I found so far. And I think that what's fascinating to me is that naturopaths are using evidence, it seems, to create evidence-based prescriptions, referrals, and treatment plans for their patients. And while this data is very general in nature, we need to have more numbers in order to critically evaluate these findings. And that's what I hope will happen. We will get more people completing the survey, and I will be able to look at this data in more detail and without bias. Thank you for listening to my presentation.